Good morning, everyone, and thank you for joining us this morning for our webinar on the benefits of occupational health physiotherapy and musculoskeletal services. Just a little bit of housekeeping before we start. Your microphones should be set to silent at the moment. We have opened the chat function, so please do feel free to pop any questions that you may have whilst we go through the webinar into that chat function, and we will happily answer any questions at the end of the webinar. This is being recorded as well, so we will share the recording with you probably tomorrow or the day after. And really what I want to do is just introduce Tracy Atkinson to you. We are absolutely over the moon. It's an absolute privilege to have Tracy Atkinson presenting today. So I'll let Tracy introduce herself and off you go.
Lovely. Thank you, Claire. Right then, so introduction to me then. So good morning to everybody, and thank you so much for joining our webinar today. So just to give you a little bit of background to myself, so I'm, as Claire said, Tracy Atkinson. I'm the Clinical Governance Director for PAM PPS. So basically, I'm a physiotherapist by background. I've been qualified, dare I say, for 31 years, and I've worked in occupational health physiotherapy for the past 28 years. So I've had a wide range of experience within the field, and I've had the opportunity over the years to work in a variety of business sectors, so from sort of public and private, from sort of food manufacturing, pharmaceuticals, councils, blue light, distribution, rail, and travel, just to name a few. And over the years, I've also had the opportunity to work in different roles as well, from an Occ Health Physio perspective. So from being delivering the actual services, to doing operational management, account management, and then more recently, over the past 4 to 5 years, specifically working in the clinical governance role and support. Okay, so what are we going to cover in the session today? Well, really to sort of go through and understand a bit better what occupational health physiotherapy actually is. Also looking at how Occ Health Physio can benefit the workplace by reducing workplace musculoskeletal problems and related absences. I'm going to touch a bit on the benefits of clinical governance to the service as well, and what that actually looks like, why it's important and what we do, and then some tips for adopting a more sort of proactive approach to managing musculoskeletal conditions and problems within the workplace, and some of the services that we do sort of cover and provide. And as Claire said, by all means, ask questions, and we've got time for questions at the end as well. So the first thing I wanted to do was really, even though we sort of call it an occupational health physiotherapy service, because obviously we have the physio service delivering, assessing, treatment and rehabilitating MSK conditions, this actually is now completed by a range of MSK clinicians who have the right level of qualifications and competency and training, depending on the service and requirements of that service. So obviously from a physio perspective, physios complete degrees, and we are regulated by the HCPC, which is the Health and Care Professional Council, and also members of the Chartered Society of Physiotherapy, which is our professional body and trade union. But we also have other MSK clinicians as well, who do a lot of training and are specialised within that field. So within the service, we now start to see more what we call GSRs, or graduate sport rehabilitators. Again, these are people who are trained to degree level, specialising in MSK, and they're registered with a professional body called BASRAT, which is the British Association of Sport Rehabilitators and Trainers, and they're accredited by the PSA, which is the Professional Standards Authority. We also have osteopaths who, again, are trained at degree level and are regulated and registered with the General Osteopathic Council. We have sports therapists, again, trained at degree level and members of the Sports Society of Sports Therapists. And then we also have specific clinicians who are trained to be DSE assessors. So even though we're talking about an occupational health physio, it's often a combination of these specialised MSK clinicians who obviously deliver and provide these type of services. So what does, what is occupational health physio and what are our sort of key aims and main purposes? Well, firstly, it's about improving health and well-being. It's ensuring that employees or individuals are fit to complete the job roles and tasks that they're required to do. And we very much look at it from a sort of physical and functional perspective in relation to that. It's also about prevention and also management of musculoskeletal conditions. So obviously, if we can prevent people getting these problems in the first place, then that's going to be so much better than trying to manage them once they have. But in reality, people are always, to a certain extent, going to have some MSK problems. It's then about reducing sickness absence and minimising the impact of that ill health. And obviously, reducing sickness absence is very beneficial to the business and the employer, but it's also really beneficial to the individual and the employee as well, because, good work is actually very good for us. And there's a whole host of benefits that we now understand why it's important for people to be in work. And there's a lot of data and information out there as well to also say how, the longer somebody is off work, the less likely they are to return back to their normal job. So if you have someone, say, for example, who's been off sick for 4 weeks, then there's probably about an 80% chance of that person coming back to their normal substantive role. And if that goes to 6 months, then that actually drops down to about 20%. So again, managing these problems, getting people back to work early and also preventing it is hugely beneficial. And then the other is about improving performance and productivity. And this is through reducing presenteeism. Now, again, lots of people tend to understand and know about sickness absence, but a lot of people don't necessarily have heard about presenteeism. And presenteeism is when you have people who are at work, who are potentially not fully fit to do the job roles that they should be doing. So then that does have that knock-on effect to that performance and productivity as well. So there are a lot of clients and businesses we work with who will often say, well, our sickness absence is very low, which is great, but then it's perhaps not fully understanding what their presenteeism is like as well. So what we want to ensure is that we are business focused. So again, it's important that we understand the challenges faced by organisations regarding their MSDs. And it's, the way I look at it is, we deal with a lot of individuals and patients who are in pain and discomfort. So it's perhaps understanding better what the pain is for the business as well in relation to these type of issues and how best we can support them. It's making sure that we align to any health, safety and well-being objectives and strategies for that business, because again, different businesses and sectors will have different challenges. We're there to support management so that they can understand better what these issues are and how to manage people and keep people back at work. So return to work treatment and rehab. And it's also about looking at the control of health risks as well. So looking at it specifically from a legality point of view, what's the legislation say? What do we need to ensure is in place? It's about reducing that litigation and claims, and again, comes back to that absence piece as well. What we're not, though, is a welfare service of sort of plasters and sympathy, just to sort of say to people, yes, it's going to be fine. We're not there for an underperforming primary and secondary healthcare. You know, unfortunately, there are challenges within the NHS service, but we're very specialised service. And again, we're not there to sort of pick up what people can't access through the healthcare process. And we're not there to sort of manage staff through the occupational health process as well. So what are the key differences then between physios that work, say, in the NHS or privately compared to occupational health physiotherapy? Basically, Occ Health Physio is a speciality of physiotherapy. So again, probably a lot of people don't know, but physio, there's lots of different areas that physios can specialise in, from musculoskeletal, neurology, paediatrics, care of the elderly, and occupational health is seen as a speciality as well. It's interesting that often it's not covered at undergraduate level either. So most physios will have the correct sort of MSK training, but then they won't necessarily have the occupational health training until they've actually qualified, and they do more sort of postgraduate or master level type training, or training with relevant occupational health providers and specialists as well. But the key difference is that we are very much about being work focused. It's understanding how to have those work conversations. It's that specialist assessment of workers in the workplace. It's making sure that any advice, treatment and rehab is again very work focused to ensure that those people will be fit to be able to do what they need to do. The other thing is we have that communication with the workplace as well, which obviously other physios, particularly in the NHS and private, wouldn't do that. So we do often will provide reports to allow managers to manage their employees more effectively and explain what's happening. And we can also provide management information as well to allow businesses to look to see, well, where are these type of issues coming from, and do that trend analysis process. You know, so it might be that we deliver a service and we suddenly start to see a lot of people with back pain from a particular area. Well, we can pick that up from the management information and then be more proactive to sort of understand, well, why is that happening and what can we do about it to make sure it doesn't get worse as well. So it's very much about having specialist skills and knowledge as well. So for Occ Health physios, it's about having really good communication skills, not only with the patient or the employee, but it's that wider stakeholder as well. In relation to HR, we might have to communicate with health and safety, line managers, senior management as well. It's having excellent verbal and written communication skills for the reports that we provide. It's having that understanding and specialist knowledge of the workplace as well, and working within that scope of practice. And things like consent and confidentiality is very different within occupational health setting as well, and also understanding employment law, the equality law, disability and the impact of that as well. So there's a whole host of areas that are much more specialised that we have to understand compared to MSK physios that aren't working within our field. Okay, and you know, this was one of the reasons why I went into occupational health very early on as well. You know, I used to get quite frustrated that if I saw patients in a clinic, you know, you'd send them away with advice and exercises, you'd do treatment, but if you can't influence maybe what is exacerbating their problem, and in particular a lot of it is perhaps what they're doing in the workplace but also outside of the workplace, then they're never going to resolve. So the fact you have the ability then to see people and actually go, right, let's go out into the workplace, let's have a look and see what you're doing, can make a massive difference to improve that outcome for someone. So what do we do? Well, as we've already talked about, we prevent and try and prevent musculoskeletal problems within the workplace. We can help assess that fitness for work. So if we're trying to get someone back into the workplace or maintain them in work to reduce the risk of exacerbation. We play a big part in health promotion and education. You know, education is very key, so individuals and employees can start to understand better what they can do themselves, what self-management can be put in place, and also taking a bit more responsibility for their health and well-being. We do a lot of research, audit and trend analysis, like I've already alluded to, by collating data to be able to understand better what the problems are and issues and how we can support. We do risk assessments, a wide variety of different types of risk assessment depending on the job role and what the requirements are, and provide training as well. And again, it's about that sort of fast track access to that specialist support, advice, treatment and rehabilitation, because again, the quicker we can see someone, the more effective our outcomes can actually be. It's also important to sort of manage those expectations with the employee, but also the employer as well, as to what we can do. So again, it's understanding the fact that obviously what we do is still very confidential. There's medical confidentiality that we have to put in place, and also ensuring that we get the right consent about what information we can share and with who. And if employees obviously do withhold or withdraw consent, then it's for the employer to understand that they can then only make decisions based on the information that they do have access to. It's making sure that we are open and approachable. So again, people feel that they can come to us with what the key issues and challenges are, and maybe potential barriers of return to work as well. It's providing equality to all, that friendliness and honesty. And it's also having that accountability, formally and informally, and also how we sit with working between the sort of employee to support them, but also quite rightly with the employer and managers to support them as well, to sort of gain, you know, work towards the goals that everybody wants. And it's being part of that team, you know, is key to build up those relationships. So again, one of the benefits from managing musculoskeletal problems is very much demonstrated with current data that's coming out as well. So this is some statistics from the HSE, the Health Safety Executive, for 22-23 in relation to musculoskeletal disorders in the workplace. So, you know, how many workers in the UK suffered from work-related musculoskeletal disorders? Well, we're still seeing for that year 500,000 people who are getting work-related problems, which is still quite significant. In relation to the amount of days lost because of this, 6.6 million. So that's still a massive amount of days lost, which has a massive impact to the employer and the employee. In relation to percentage-wise, we're looking at about 27% of all work-related ill health cases being linked to musculoskeletal disorders. Now, interestingly, for a long time, it's always tended to be the main reason why people have been off on the sick. But what we have seen over the past number of years is that, you know, obviously mental health type issues have started to overtake that now in relation to stress, anxiety and depression. But as we know, and a lot of the evidence shows, there is a massive link between physical and mental health, and often it's very difficult to sort of separate one without the other. And then how much do MSDs cost the industry per year? Well, for the economy, we're still looking at 7.4 billion a year in relation to these type of problems happening within the workplace, which is huge. When we look at it from a sort of area as to where the majority of problems are coming from, you can see here that back and upper limb and neck are equal. Now, again, for many years, we saw that backs tended to be the highest, but we've started to see that increase of upper limb and neck. And part of that is believed to be because of obviously the technology that we're using nowadays. We have a lot more people working with computers. We have more people now working at home, hybrid working, and most people nowadays have mobile or smart technology in relation to phones, tablets, and those type of devices as part of their job roles as well. So again, when we look at the data, it's still a large area as to why businesses are struggling and why it's important we try and sort of be more proactive with managing them. So the benefits to the employers then, which we've probably covered most of these, is it's about hopefully reduction in costs. It's providing a happy, healthy workforce who we know will then be more productive and achieve their sort of full potential. It's making sure that we are compliant with legislation and ensuring everything is in place, things like risk assessments. It then improves that relationship between employees and the organisation and community. It should hopefully have a knock-on effect that it then reduces staff turnover and actually can improve recruitment as well, as it can improve overall corporate image to show that employees are valued, they are looked after, and seen as a valuable asset to the business. It's about improved workforce productivity, earlier return to work, reduced litigation. So there's a whole host of benefits that can be accounted for. And then from an employee perspective, they're going to get that occupational health speciality in the fact that not only can we treat an MSK problem, but we understand the workplace as well and the requirements of that and the functionality of that as well. It's often quicker access than people can get through their GP and the NHS. As we've said, it's more workplace focused. There's more consistency in relation to understanding what the requirements of their job role is. And it's the fact we have that ability to have that dialogue with employers as well, which is really valued. So it's very much about teamwork and having those key stakeholder relationships and building up those relationships. From a management perspective, we work with people from sort of board level, senior managers and line managers, because again, it's really important to get that buy-in higher up to be able to ensure that we can put things in place to reduce these. It's then having those relationships with the right specialists from occupational health professionals, HR, the health and safety team, and then also the employees themselves. And very often we will get involved with relationships with workers' representatives and unions as well, to ensure that they understand what we are trying to achieve and what we can help to support. So the typical lines of communication would be, obviously, as we've said, with the OC health professionals, with line management, human resources and health and safety. And again, depending on the client and depending on the sort of relationship and contract we have, we can work with a variety of different stakeholders depending on what their needs are. It's about that shared responsibility. You know, we're there to provide our expertise and speciality, but it's also having that employee responsibility and the employer responsibility to work together to try and make sure we can achieve those aims and end results as well. So part of the process for the OC Health Physio and the services and making sure that we deliver a high quality service is the governance of OC Health Physio. So, you know, it's understanding, well, what is clinical governance? Why is it important? And what does that look like in the occupational health physio world? So when we talk about clinical governance, it's basically looking at quality and safety systems within for individuals in an organisation to make sure that we are achieving those high clinical standards that we want to from a practice perspective. And the Department of Health define clinical governance as a framework through which organisations are accountable to continually improve quality of services and deliver the excellence of care. And for me, it's very much about that continual improvement. You know, it's always looking at, well, how can we do better? What needs to be improved? What can we put in place? Okay. And we often work towards sort of 3 key attributes in clinical governance. So like I say, it's recognizing what those high standards are for delivery. It's making sure that we're very transparent about responsibility and accountability for those standards. And like I say, it's that ethos to ensure that we are doing that continual improvement. When we look at clinical governance, we tend to follow what's called the 7 pillars of governance. So the first one there you can see is in relation to clinical audit. So audit is undertaken basically to monitor the quality of care, and it's often set against guidelines or standards, so we can ensure that our clinicians, our processes, our procedures are being followed and meeting those required standards. And if not, it allows us to identify where those gaps are and then what we can put in place to make sure we are making those improvements and get the desired effect. It's then about that clinical effectiveness, and we work to what's called best evidence-based practice. So we will look to see what the research out there is demonstrating is effective and ensuring that our practice and again our procedures are following that, to ensure that we're getting the best outcomes for our employees and patients, but also businesses as well. And it's obviously very important that clinicians do follow sort of that training and development in relation to ensuring clinical effectiveness as well. The third one there is risk management. So again, that aims to minimise the risks to the business, to the clinicians and colleagues, but also to our clients as well. And again, for me, that's part of learning from adverse events, the feedback that we get, and based on that feedback, again, reviewing that and seeing what we can put in place to ensure it doesn't happen again, or how we can learn from that as well to reduce risks. The fourth one is information. And as you can appreciate, we deal with a significant amount of personal and sensitive information through the delivery of our services. So therefore, it's paramount that our colleagues are very clear on, again, confidentiality and consent, but we also have very clear processes in place for data protection as well. So we have to have a very strong infrastructure to ensure that we are meeting all of those as well. Education and training. So again, very important for the service, for clinicians, for knowledge, experience, professionalism and behaviour, and ensuring that the services delivered are, people who are delivering those services are properly trained and competent to do that. And again, providing evidence-based delivery. Leadership, really important, because again, we need to ensure that leaders are, again, the same, supporting and promoting high quality services, meeting expectations and ensuring that people are meeting those behaviours and strategies and qualities as well. And then lastly, it's about that involvement piece. So it's involving colleagues, the business, but very importantly, the clients that we're working with to deliver those services. And again, it's gaining that feedback to ensure that we can look at that continual improvement. So all of those key pillars we embed to ensure that we're meeting those standards. From a quality assurance perspective, then, we do this internally by having a robust governance structure in place. As I've mentioned, we follow evidence-based clinical practice. We ensure that we are adhering to any professional codes of conduct. And part of that, we provide a lot of training, support, development, supervision. And with PAM, we actually have our own PAM Academy, which has been set up to ensure that the varying clinicians and colleagues have the specific training that they need for the roles that they do. And again, we can make sure we're measuring that competency and ensuring that they're meeting that quality standard. And we also have things called PROMs and PREMs. So PROMs are looking at what we call outcome measures or clinical outcome measures to ensure that we are getting that clinical effectiveness, and we're using validated tools to be able to do that. And PREMs is basically what we refer to as an experience measure. So again, it's getting that feedback. So again, at PAM, we have PAM Listen, and we do send out feedback to any clients on a regular basis, because again, we need to understand, what are we doing well, but also what we're not doing so well, so we can learn and improve from that. From an external quality assurance, so there is lots of accreditations that we have been able to achieve as an organisation, which is not just a rubber stamp sort of internally to say we're meeting those standards. These are external accreditations where we do get audited to be able to demonstrate we're meeting those industry standards as well. So you can see there we have, we've got an array of them from the Care Quality Commission, which is a requirement through NHS, the ISOs, which is very much looking at sort of the quality management, IT infrastructure, disaster recovery. We have Cyber Essentials, which is again IT. CQOSH, I'm going to come on to that in a bit more in a minute. Investors in People, and Safe Supplier, which again is often a requirement from a lot of clients as well. So again, it hopefully demonstrates that we do have that external assurance as well that we're meeting these quality standards. Specifically from a Occ Health Physio perspective, we also are members and work with what's called ACPO, which is the Association of Chartered Physios in Occ Health and Ergonomics. This is one of the largest professional networks of the Chartered Society of Physiotherapy, and this is designed specifically for those clinicians who work within an occupational health setting, but it also encourages others who don't, to understand more about what it is we do and the speciality of the service. And the whole purpose again is to improve the health and well-being of workers so that they can do their jobs effectively and efficiently. And we can do this through improved work design, through ergonomics, work tasks, making them comfortable and safe. And I had the great privilege of being part of the exec committee of ACPO for 8 years, and was able to influence a lot of the guidance and standards that we do have within the industry at the minute. And there are a lot of other occupational health professional networks we also work with and feed into, which is the Faculty of Occupational Medicine for the physicians. We have the Chartered Institute of Ergonomics and Human Factors, the Council for Work and Health, which is obviously more at a government level, which ACPO does represent and feed into, the Faculty of Occupational Health Nursing, and the Society of Occupational Medicine. Just coming back to CQOSH, so CQOSH stands for Safe, Effective, Quality Occupational Health Services, and again, some of you may have heard of this accreditation, some of you may not have, but again, it's an accreditation that was set up through the Faculty of Occupational Medicine to actually work towards certain standards within occupational health and ensure that these are being met. And over the past, I would say probably 8 years, ACPO worked very closely with CQOSH to ensure that occupational health physio was part of that process and is embedded into that structure. And again, more recently, I've been part of the working party for the Occ Health Physio side to review the standards that they've recently reviewed and then put out there as well. So what are the benefits of CQOSH to businesses? Well, again, it shows that we've got that external recognition of competency. It does identify that we put into practice, good practice, and we build on that. It helps us to identify where the gaps are and where improvements can be made. It's a really useful for me, it's hard, but it's a very useful exercise to go through, because it does make you realise what you're doing well, but what you're not doing quite so well, and where you can improve on that. So it's that consistency and improvement all the time. So how can an organisation hopefully be more proactive in relation to musculoskeletal disorders in the workplace? Well, again, our service is very much looking at that health and well-being approach. It's about being more proactive, and we follow what's called the biopsychosocial approach as well, where we look at a variety of different, we refer to them as flags, but it's basically barriers to different aspects of recovery and work and things like that. So it's very much looking at a very holistic approach with the individual, and looking at them as a whole person, not just a back or a knee. So we sort of split our services into sort of 4 key areas. Obviously, there's the prevention side. So, we get involved with health and wellbeing days and campaigns. So a lot of organisations nowadays will have their own health and wellbeing teams or strategies, and we can then tap into that and support from a specific MSD perspective. We've provided toolbox talks specific to job roles, where we've actually gone out with those particular employees, demonstrated specific stretches and exercises related to their job role. We can provide exercise classes for strengthening, conditioning, Pilates, provide posters, leaflets, infographics to support campaigns and businesses, body mapping to understand better, well, where are the key MSD issues, and again, that trend analysis, and things like this, providing webinars for specific topics or areas of concern to improve that education and awareness. From an assessment point of view, this is where we can try and reduce and identify where those key risks are to help reduce them in the first place. And we do this again through a variety of services, looking at task analysis, physical capability assessments, where we're looking at that specific individual against a job role, DSE, vehicle, ergonomic workstations, and then to very detailed ergonomic workplace risk assessments, where we can look at whole processes from start to finish to see where those MSD issues are, and then be able to actually start to look at what are those risks? How can we problem solve? And I've been, in the past, I've been very fortunate to even have the opportunity when businesses are starting to design new processes, production lines, bringing in new bits of kit, things like that, to actually be right at the beginning of the process, to be able to say, well, actually, have you thought about this? You need to consider that. We do rehabilitation. So again, it's really important that when you have got employees with these type of problems, that they do get the right treatment and rehabilitation as well. And again, we do this remotely through what we call PHIL, physio information line, telephone. We can do face-to-face, and we have other programs in place like persistent pain program and physical endurance programs, depending on the requirements of the individuals. And then the other way we can reduce it is through awareness and training. So things like manual handling training, train the trainer, DSE, and ergonomic risk assessment training. And again, the premise of the training is to make it relevant and specific to the individual's needs, but also the business needs. So it's making it more relevant by bringing in specific tasks, doing practicals in the workplace as well. So there is a whole host of ways in which we can start to be more proactive within the workplace. So it's about that health and wellbeing approach. As we've said, happy, healthy employees are more productive. It's promoting health and physical activity in work, but also outside of work as well. We've got to remember, it's not just what people do at work that maybe cause some of these issues. It's a whole host of contributing factors, and being fit and healthy outside of work is really important as well for physical and mental health. And it's promoting those healthy lifestyle choices. Promoting workplace exercise, though, is important. Movement is good for us, and if I could bottle and put exercise in a pill, I'd be a very rich woman. It'd be great. But it's about moving. And this is the problem we have with a lot of people, particularly people with sedentary jobs or, computer-based jobs. People just don't move enough, and we're designed to move. So again, it's looking at what stretches, exercises we can encourage within the workplace. And what we have done previously is things like Stay Fit at Work posters, where we've had the opportunity to actually take photographs with consent of individuals within the workplace doing these exercises. So again, it's more relatable for employees. And again, going back to that workplace health promotion side, it's tapping into health and wellbeing days, looking at what the company perks are, what access people do have to trying to keep fit and healthy, exercise, activity, sports clubs. Obviously, we provide, excuse me, on-site physio to access, and remote education that I've mentioned, toolbox talks, body mapping. And the key thing as well is about reporting and early referral. The sooner we can see someone, the better the outcomes tend to be. So it's having those processes in place to ensure that managers know what's available to them and their employees, and how they actually go through that process and making it really clear and accessible. So just to finish off with, it's all about having that integrated delivery model. It's about providing health and safety with the support that they need from a risk assessment and understanding the MSD risks. It's about occupational health and support it. We can support through case conferences. It's about being proactive in the workplace, getting out into the workplace, understanding what people are doing and understanding what those risks are. Bespoke training for managers and employees, health and wellbeing events, restriction. We've done restriction review projects. So if people are on a lot of adjustments or restrictions within the workplace, we can support with that. Task analysis and training programs, and regular meetings as well with relevant key stakeholders, depending on what the issues and challenges are. And that's it. I think you probably had enough of me talking at you now.
Thank you for that, Tracy. That was absolutely brilliant. A really, really insightful webinar there. Loads of information definitely there. Nothing has come into the chat function as yet, but we'll just give you a few minutes. If anyone does have anything that they want to ask, please do feel free. We have got our, thank you, Tracy. We have got our website that you can have a look at. Our services are all on there, and we also have other webinars that you can access as well as blogs, and we have information leaflets, myth busting on there as well, all sorts of different resources, videos and things that you can absolutely pull off and use for your own organisation. You can share with friends and family, lots and lots of information there for everyone to have a look at and understand what we do and how we do it. And here's just an example of some of the things that we do produce and create for you. And I think it's really important to say that obviously on the back of everything that Tracy's just told us about the specialism of occupational health physiotherapy, everything that's on our website and that has been produced by our team. So it is clinically endorsed. It's not a Google document. It's things that we have put our clinical knowledge into, and Tracy has vast clinical knowledge. And then I've got 20 years experience as well to add to that. So it's all really robust and evidence-based things that we produce for people to be able to use. Carol, thank you. Carol's there just saying brilliant information. Thank you, Tracy. So thank you, Carol, for that. So if you would like further information, you can contact us. That's our email address there. We do have a phone number as well if you do want to call. Our head office number is 01925 989 741.